What is asthma? Asthma is a long-term disease of the lungs. You might hear your doctor call it a chronic respiratory disease. It causes your airways to get inflamed and narrow and makes breathing difficult. Coughing, wheezing, shortness of breath, and chest tightness are classic asthma symptoms. Severe asthma can make it hard to talk or be active. Some people refer to asthma as bronchial asthma. Symptoms of asthma. There are three major features of asthma. 1. Airway obstruction. When you breathe normally, the bands of muscle that surround your airways are relaxed and air moves freely. But when you have asthma, those bands of muscle tighten. Air can't move freely. When there's less air in your lungs, you feel short of breath. The air moving out through your tightened airways causes wheezing. 2. Inflammation. People with asthma have red and swollen bronchial tubes. This inflammation can damage the lungs. Treating this inflammation is key to managing asthma in the long run. 3. Airway irritability. People with asthma have sensitive airways that tend to overreact and narrow due to even the slightest triggers. There are many asthma treatments available to relieve your symptoms. Inhaled corticosteroids. These medications are used to treat asthma in the long term. That means you'll take it every day to keep your asthma under control. They prevent and ease swelling inside your airways, and they may cut down mucus production. Leukotriene modifiers. Another long-term asthma treatment. These medications block the action of leukotrienes, substances in your body that trigger an asthma attack. You take them as a pill once a day. For a recommended asthma relief medicine, visit the link given in the description of the video.